Hi, everyone. We'll just give it another minute or two while folks enter the room. All right, good morning. Well, good afternoon, good morning to some. Hi, and my name is Minnie Martin, and on behalf of the HHS Office of Intergovernmental and External Affairs, I'd like to welcome you to today's briefing. Just a quick housekeeping note, the call is being recorded, and if you are a member of the press, please direct any press inquiries for HHS to our press office at media@hhs.gov. So it looks like the ticker is slowing down. Again, thank you so much for joining. And I am going to now turn it over to Rachel Fisher.
Hello, everyone. Thank you so much for being here today. My name is Rachel Fisher, and I'm a senior advisor in the Office of Disease Prevention and Health Promotion, as well as one of the co-leads for the HHS Food as Medicine Initiative, along with my colleague, Erin McDonald, who you'll hear from in a little bit. We are incredibly pleased to be here today sharing a number of updates with you, but most importantly, the launch of a new Food as Medicine virtual toolkit. However, before we share details about the toolkit, I would like to welcome Admiral Rachel Levine, the Assistant Secretary for Health at the U.S. Department of Health and Human Services, to share some words with us. Thank you, Admiral.
Well, good afternoon. Thank you very much, Rachel. I am thrilled to have you join us today for the launch of the HHS Food is Medicine Initiative Toolkit. HHS, our federal department partners, and a wide range of external collaborators have contributed to this important work over the last year. We are excited to share this unified toolkit and to signal our strong commitment and continue to champion food is medicine efforts across a wide range of communities nationally. The work to help all Americans lead healthy lifestyles is a key goal of my office, the Office of the Assistant Secretary for Health, and one that as a pediatrician is very close to my heart. Access to nutritious food is critical to health and resilience. Food is an essential component of a person's ability to thrive. However, we have much work to do to ensure that all individuals have access to healthy food, and we have the statistics to show that we've got work to do. Last year, Congress directed funding to HHS to develop and implement a federal strategy to reduce nutrition-related chronic diseases and food insecurity, to improve health and racial equity in the United States. This includes diet-related research and programmatic efforts that will increase access to food is medicine initiatives. I want to specifically mention the championship of Representative Barbara Lee, who made the funding available to support the development of the foundational resources that we are releasing today. We look forward to continuing to build on this important commitment in the next steps for this work. Food as medicine encompasses a broad range of approaches that promote optimal health and healing and reduce disease burden by providing nutritious food in conjunction with human services, education, and policy changes. Through collaboration at the nexus of healthcare and community. Excuse me. We all have a role to play in making this approach successful. The HHS Food as Medicine Toolkit is designed to be a dynamic resource that supports a range of communities, implementers, and professionals at all levels and in all sectors, in helping them catalyze the development, implementation, and expansion of food is medicine initiatives around the country. This new collection of resources provides tools that can deepen everyone's understanding of what the food is medicine approach to health can accomplish, and help people from all walks of life develop and implement food as medicine initiatives that work for the people right in their communities. This new suite of resources provides case studies with actionable insights It identifies federal and state policies that support these initiatives. And perhaps most importantly, it shows that food is medicine initiatives are most successful when they are customized to meet the needs of the people and the communities that they serve. Having good sources of food and healthy communities supports social cohesion, and it empowers people and those communities. We welcome you to visit health.gov/foodismedicine. All one word, health.gov/foodismedicine, to tap into this new resource. We can only accomplish this ambitious goal of ending hunger and reducing diet-related disease if we all work together to achieve it. We will now hear from our co-leads for the HHS Food is Medicine initiative to provide more details on the new virtual toolkit and next steps. Thank you very much.
Thank you so much, Admiral Levine. We are so pleased to have such incredible, can't get my camera to go back on. We are so pleased to have such incredible support from HHS leadership on this important initiative. It is truly an honor. To work alongside such dedicated champions. As you will hear shortly, the toolkit we are launching today is the result of the efforts of many champions from across the federal government and beyond. While we have long appreciated the importance of that food and nutrition play in our overall health, this particular initiative was born out of the White House Conference on Hunger, Nutrition, and Health, which just celebrated its 2-year anniversary. Pillar 2 of the national strategy focused on the integration of nutrition and health. And since the conference, HHS has taken very intentional steps to better align and advance federal action to do just that. We officially launched a Food is Medicine initiative last year with support from Congress and have been working alongside our federal colleagues to bring you this virtual toolkit. I'm now going to turn it over to my co-lead, Erin McDonald, to talk about the initiative and the toolkit in more depth.
Thanks, Rachel. Hi, everyone. It's a pleasure to be with you. We are thrilled that we are here today to share about the work. I'm going to do some highlighting of the resources that are now available to you on the Toolkit virtual site that Admiral Levine spoke to in terms of where you can find it. We'll pop it in the chat as well. But the work, really importantly, is because of the incredible championship and partnership across the federal government. So I'm going to start by sharing a bit about the way we've approached the work, and then we're going to take a visual kind of look and peek through the resources that are now available to you online. So as we've talked about for a long time, this work was born out of collaboration. It was built in collaboration. It will continue to grow in collaboration in the federal family and with an incredible range of partners from many different sectors, many different walks of life and expertise in terms of all of the different perspectives and expertise that we've benefited from that we're hoping that you'll see and continue to see in the work that we're developing. Within the federal family, you'll see that the way that we have structured the work is in collaboration. So as HHS is leading and has carried the management of the virtual toolkit and the effort around food as medicine, there's incredible partnership and collaboration from colleagues from USDA, from HUD, from the from the Department of Veterans Affairs, from the National Endowment of the Arts, Department of Commerce, Department of Transportation, and we are continuing to grow that range of partners across the federal family within HHS and beyond. So when we started into this work, we really saw a very clear foundational place for our federal colleagues and ourselves to spend time and attention in the ways that we were approaching building the resources that are now available. The first was really to do that in partnership and to build partners in this work where many of us continue to see ourselves and in relationship to food as medicine and cultivating it, and that we're bringing others into the frame of understanding how they relate to this work and how they can support it. So that has been true from day one, and it continues to be true in how we're releasing the work today and how we're looking forward to building on that work to come. We're really focused on, and we heard really loud and clear that a lot of the opportunity that we could offer as a starting point was really providing enabling tools. There's a range of ways that food as medicine is present and growing and needs to grow in very different communities and systems. And we want to help enable that. And we want to help create space for collaborative understanding, for really enabling folks to have access to tools and resources that allow them and their perspectives and systems and expertise to be able to lean in and leverage those resources. The third was really creating a shared ethos, and that will be important in what we share around the ways that we've framed food as medicine, and we'll talk about that in a moment, how we really look at having a collaborative perspective in the opportunities and our understanding about the work that we're trying to accomplish and the reasons behind that. And then finally, to really develop collaborative action. We see that true in many different communities in the ways that many of you are really proceeding in identifying and designing and cultivating interventions that really speak to a range of very different collaborative opportunities, leaning into the assets and strengths of communities to really offer a perspective on food as medicine that is lasting and offers opportunities for a range of partners to be involved. So those are our key perspectives and why we took the approach in terms of the resources and the way we've structured resources that we'll talk about in the virtual toolkit. So defining food as medicine, one of the things that was really important when we set out on this journey was understanding that we all have very different and yet shared language and shared commitment, and that it was important as a federal family and as HHS to really set out a perspective of framing language. And what do we mean when we talk about food as medicine? And how do we offer language that helps folks understand and find connection, but also clarity in what we're looking to offer as a resource and a point of view about action that can be taken. So you'll see the framing language that was released in January at our national summit around food as medicine that Secretary Becerra signed off on, and that we've continued to champion in the ways that we have really looked at understanding and built in partnership. And that language was really importantly associated with guiding principles. So framing language is important, but what it looks and feels like, what do we want all food as medicine interventions and efforts to really be guided by and to really appreciate in the principles that we are looking to really offer a perspective that we can help everyone see themselves in, and then also understand that there's nuances in the ways that it will look and feel in communities that are also guided by those different tenets. We have taken an ecosystem approach to this work, which has meant that we have really looked at the relationship of food as medicine as having a relationship at the juncture of the healthcare system and many different contexts where individuals and communities and households come into a relationship to food as medicine, or the possibility of being in relationship to food as medicine. So that has ranged from places like the clinical environment very clearly to age and stage related environments where that is appropriate and how we're serving individuals, to social service access and how that can be in complement, to technology-enabled access in the ways that we all live our lives now and are really looking to understand how we can really understand environments that we can integrate and benefit and understand how food as medicine can act in those spaces. And that we have catalysts that can really look at those environments and understand across those areas of where folks are interacting, what is really important to support their relationship to resources. And that has included really understanding cultural relationships to food, understanding enabling policy environments that are going to facilitate or maybe lessen the ability to access. And we want to help make sure that we're really looking at and understanding those policy environments to enable greater access. Social responsibility in the ways that we communicate, or how we look at champions for speaking to and about this work and why it's so important from very different perspectives. And that we all have relationship from very different sectors of enabling conditions. So that can include things like technology and marketing and supply chain, to the way that we think about food production quality, to insurance and relationships to access. So we've really looked at both how do we understand and invite folks into a relationship to food as medicine, and then understanding where we actually have very clear opportunity and resources to really shift the way that we operate and how we can really look at the ways that we function in relationship to those systems and those places that individuals would interact with food as medicine opportunities. So with that in mind, one of the things that has been really important is we took a look across a lot of very different interventions around food as medicine, and they range, right? We all know that there's a lot of conversation importantly around medically tailored meals and produce prescriptions, and growing conversations about other models like medically supported groceries and meals, to nutrition incentives. And what was really important is that those are going to look very different. And there's a range of need as well as depth of intervention or the model that's appropriate for different health or individual health-related conditions and needs. But across all of them, we've really understood that it's really important to see these 4 different qualities, and they will look different or be present in different degrees or in different modalities. But across any food as medicine intervention or model, we really want to see and think it's central to have available a relationship to food provision, very centrally. The relationship in association with that to a clinical or a care team that is really helping to navigate or create access to an opportunity that relates to food provision and how that has a bearing on health conditions or diseases that are presenting within the clinical or the healthcare environment. And then we're really bolstering those different, those 2 pieces with navigation to resources of food, as well as other wraparound resources that are really important for folks around other types of benefits or their supports that would be appropriate for them and their different condition or need in terms of their relationship or their life circumstances. And then finally, and really importantly, education support. So how are we enabling more practice and more engagement and more ability for individuals to really be in relationship to food in healthy ways and to really understand how do they continue that long after an interaction within the health system that's provoking or identifying that is a need that would be of value. So understanding those 4 different core elements, we also have understood that we often talk about that pyramid or that kind of hierarchy of very different levels of need, where at the top of that visual, at the center of what we have on the slide here, that medically tailored meals and groceries are for folks that might have more acute or in-depth of need that is more aligned or tailored to a health condition or disease state that we're looking to intervene around. And that as that moves down the pyramid, that we're really looking at building and supporting greater access and connectivity across different levels of need, but there's an expanded group of folks that might in community or individual relationships in the health system or care setting to have different levels or lesser depth of need, but equally that we're in relationship to a food as medicine intervention or opportunity across those levels, but that there's a broader range of folks that might be appropriate to serve and to be benefited by that model in particular. And that you'll see surrounding that, those relationships is nutrition counseling and education as a part of any of those levels of intervention that is really important to maintaining that opportunity and ability to access support. Now, we in the federal family have really understood that there are many different resources that can support and enable food as medicine interventions and systems of care and how we have a relationship to that work, but many of them actually exist in that relationship around the pyramid. And so we have identified those different enabling or complementary systems where we're really looking at our resources in relationship to that work, and that includes food and nutrition security resources, food production resources, healthy food access environments, those physical places and spaces that people come and are able to engage in and receive access to food as medicine resources and interventions or food resources, health delivery systems in a more expansive way in terms of how they relate to food as medicine interventions. And so we've really, as you'll see in the resources that are available online now, have really looked across both the pyramid and these enabling systems to really understand how can we support a very complete system of care that can support food as medicine interventions in the long term. One of the things that we also really looked at was the incredible opportunity around learning and measurement and insight in an implementation setting and an evaluative quality. So there is an incredible amount of research that has been done and that is ongoing and that will continue to happen to really support food as medicine interventions. And we champion that and honor it and really want to be in partnership around that learning. We also have really understood that we, in partnership with a range of different partners, identified that an analytic framework would be really helpful to many individuals and communities, especially those that are implementing food as medicine interventions or are looking to evaluate food as medicine interventions, to really look at how can we create a shared perspective around a framework of what it is that we'd like to see included, from guiding analytic principles to measurement domains to particular measures and indicators in relationship to food as medicine, and what are really important anchor points or the scope of what we're naming as important dimensions of understanding in relationship to food as medicine interventions and measurement qualities. And so you'll see on the right side of the screen, the priority measurement domains that we've identified. And as we'll talk about, we'll be continuing that work as we go forward, but there's a depth of resources that we are starting with and releasing today that will be available to you to peruse, that are built on the expertise and the wisdom of folks that have done that work as researchers and implementers to really understand what are important qualities of measurement where we have real coalescence or real alignment around important qualities of understanding. We also have identified that this should be partnership framed. And so it is not the expectation ever that every program or every partner should measure all things, but that there's an opportunity to understand what are measures and indicators that have relationship and can really look at outcomes from both an individual patient perspective as well as a system or more of a capacity orientation to understand systems of care around food as medicine. All right, so the fun stuff. So all of you have access to this online. So I'm hoping that this is old news in terms of what I'm going to share. But for those that want just a bit of navigation, we're going to spend a little bit of time going through what the virtual toolkit looks like and some dimensions just to point out some exciting things that live within very different dimensions of the site itself. So when you go to the landing page or the home page, you will see that there's a complement of high-level orienting information around the framing language. We have Admiral Levine in conversation with an individual who is a person that has benefited from a food as medicine intervention in the Washington, D.C. area. There will also be a series of videos that she has done that will be released throughout this week and into the next weeks that we are continuing to highlight very different perspectives from patients to implementers to providers to researchers to thought leaders who are doing dynamic work from an innovation perspective. So providing that context and that texture around the human and the professional experiences of individuals that have a relationship to food as medicine. And we're excited to share those perspectives. We also have information about some of the key points of view of data that also live in great detail on the site. And then a highlight of some of the bright spots, which are those kind of case examples or how we like to think about those secrets in the sauce of different thought leaders that are doing this work. And how do we understand more about what they are doing and what they're seeing makes a difference? So that's what you'll see around the navigational kind of pieces at the front end of the resource. So when you look at the web environment, you'll see that there are 5 tiles that exist along the headline of the environment that you can interact with. Those include drop downs where you can select subpages, where you can click on that main element or that heading, and it will take you to a page that has tiles that offer you navigational support to kind of dive into any of these different pieces that are of interest and value and that live across these different environments. So, for example, we have the first, which are the principles of food as medicine, the vision around food as medicine from an HHS and federal family perspective, exploring the landscape of food as medicine. That's an important call out because that is where the landscape resource lives. It is a weighty tome of good thought partnership across the federal government that is downloadable, that you can digest at your leisure, that is a resource that lives in much greater depth within a document or a PDF that's available for your navigation or your use. We have some really great resources around select policy interventions or pathways. That is also a resource that you can download and look at that was developed in partnership with our HHS colleagues from a range of perspectives, and then types of interventions that offer more perspective and context around the details of different ways that food as medicine is implemented to date and can be understood by a range of partners. The next group of resources is promising practices and tools. So we'll pull up a further spotlight on this in a moment, but some of the major elements that live within this component of the web toolkit are promising practices overall, training and education tools. I'll speak to that in a moment. Real world examples, that's where those bright spots live. And those are those incredible exemplars that are many, and we hope to do many of these over time, that we have developed in partnership with the organizations and partners that you see named as those exemplars, where we are really working with them to unpack what are those pieces that were so central to date in really supporting their ability to develop food as medicine perspectives perspectives from a HRSA related or HRSA supported health center or an FQHC, to retail environments, to the Veterans Health Affairs Administration partnership around teaching kitchens. There's a range of different models that are highlighted there. And then we have state healthcare structures that I'll speak to in a moment. So under promising practices, you'll see that there are a range of tiles that exist within that dimension of the toolkit. And those were developed in partnership with a range of thought leaders and partners from HRSA supported health centers that really helped us understand, what does this look like and how do we implement food as medicine interventions in very different settings within health center environments, to really understanding state leader perspectives in a range of states where they are either currently developing or implementing 1115 demonstration pilots or in lieu of service relationships to food as medicine. And what does that mean in terms of how they are creating insight? And so those are organized around themes and insights that were offered by those perspectives. We also have other tools and resources that really look at the relationship of community-based organizations and structures that have been important to date in CBOs in relationship to to healthcare systems, to understand how we can understand exemplars and structures of how those partnerships are working. So we are hopeful that you'll look at those resources, benefit from them, and I just want to continue to offer that they have been developed in partnership with experts and practitioners, and that we look forward to continuing to build on those different perspectives as we go forward. One of the things that I also called out was the state healthcare structures. And so this is really exciting because this is, you will see when you navigate to this part of the toolkit that you can select a state. And all of the states are included in this resource, and you can select and look at perspectives from Medicaid. You can look at Medicare Advantage. And this is data that is publicly available and coming together for the first time in use. It will be available shortly in downloadable format, and it is currently available as an infographic format to help you understand a range of perspectives from benefits offered around food as medicine in that state, to really understand what are some of the structures that we need in relationship to understanding what are opportunities to food as medicine and populations that would be benefited by these different resources or interventions. The percentage of the population that is experiencing food insecurity, and that is in relationship to some of those other conditions or qualities that are called out in relationship to those issue areas, plans and benefits, as well as the types of nutrition benefit types that exist within that state, and that insurance structure that exists through a Medicaid or a Medicare Advantage relationship. Again, that will be available at the state and down to the county level. And we work with our incredible colleagues to develop those resources. And we're looking forward to building on these, and they will be refreshed annually to make sure that they are current and that we're building on that understanding as we collectively move forward in this work. So we're looking forward to your feedback on that. The other thing I'll just point out on this page is that we tried to build in some breadcrumbs. So we all like to create our own adventure. And so we really look to be able to do that within the toolkit. But you'll find at the bottom of the page that if you have found yourself on a page that we have work to discern, that because there's such a wealth of information and resources that you could think about going to next, we on every page have offered that these other resources might be of value and interest to you. And so we have offered a perspective on that in terms of some other places that might be of value to spend time and to select as a next step to really pursue and understand. All right, so research and measurement is our third area of focus in the toolkit. And you'll see that there are three major spaces that we are naming to date, and look forward to building these out over time. And the first is around research on intervention. So there's been incredible work done by the Aspen Institute, Food and Society effort that is really incredible and has done a beautiful job really capturing insight from research leaders and experts to really understand what do we know to date. And we have been able to partner with them in building out that resource to make that insight available in a digestible format, and then also offer the opportunity to link into that resource in more complete form if that would be something of value to look further at in terms of understanding. We also have public input on research needs that I'll speak to in a moment, and then the analytic framework, where there's a range of pages that speak to those dimensions that I spoke to earlier around the framework that really looks to date at those domains, those subdomains, and then the indicators within those subdomains, and that will be built out over time. So you can interact with those on the web pages. You can also download that in a more complete format to really see the domains, subdomains, and the indicators that have been named by that group of thought leaders and partners that work with us to really provide input into shaping that, that thinking that we have been able to offer. So the food as medicine research needs, I will call this out because this was done in partnership with our wonderful colleagues over at NIH, and a range of federal partners that really provided input, as well as incredible thought leaders and partners from a range of different external organizations and communities and individuals that really offered perspective through an RFI that asked for perspective around a range of different qualities in relationship to food as medicine. And we really focused on highlighting and summarizing the insights that were offered as a summation to what were different perspectives around research needs, what do we know to date, what are different modalities that are being used to collect those insights to date. And so that is available as a material that you can download and really be able to look at in greater depth around what those insights were from the RFI that were offered. So we're looking forward to your perspectives on that as well. So the Federal Resource Hub, this relates to that visual that I shared in relationship to that pyramid of food as medicine, or that kind of that organizing quality of moving from more population and broader interventions to more in-depth and clinical care that's more pointed to particular health conditions and needs and personalized in regard, and those different enabling systems that live alongside those different interventions or models of food as medicine. And so we have made available with our federal colleagues, and we look forward to building this out further over time, a range of resources that look at particular federal resources, from education to funding to policy to infrastructure to regulatory actions to training and research. And so you can select an option if you desire to look particularly at resources that are related or coded to be in relationship to any of those different levers or ways of working that resource is available. And it will then populate those federal resources that have been identified to date in relationship to supporting food as medicine, or could be used to support food as medicine interventions in a range of different communities and systems, what that resource is. And then each of them, once you select one, will actually open a page that offers more particular information that's a summary of that resource, key points about how it works, its relationship to food as medicine, and a range of other points of information that are relevant depending on the resource. It also allows you to go and connect into that resource directly. And we're excited to hear how this resonates and how we can deepen the insight and the connections of understanding those federal resources over time. The other piece that is on the Federal Resource Hub is that we all have a lot of questions, right? We get questions all the time. What are federal resources that support food as medicine or can support food as medicine? What are resources in that exist in relationship to transportation that can support food as medicine? And so we have started, and we'll be building out over time some of those common questions that we get that we're able to offer perspective on right now. And so you'll see that on the left-hand side of this pullout that there's a group of topics. And once you click into that, you can see this is one that I just selected to grab a visual of under the Understanding Food as Medicine, where there's deeper questions that have often come up that we're seeking to provide some input back to you all, and many different partners that could be helpful. Maybe it's something that you grab and share with other colleagues or folks that you're looking to help support understand food as medicine, or learn more about data and evaluation or funding around particular qualities, and that we would love to be able to be in partnership and identify what are some of those other questions that we're hoping to answer as we continue on this work and this journey together. So. All right, finally, and very importantly, is about the initiative. So this dimension of the toolkit really highlights how we started this work that you heard from at the outset from Admiral Levine and from Rachel. It shares a little bit more about our approach. It honors and celebrates just many of you who in the federal family and outside the federal family have been partners to date, and we look forward to growing that list. And then it highlights our public-private partnerships that we're going to talk about in a moment, and really lifts up different ways that we're acting in partnership and really hoping to expand the ways that we are building collaboration and partnership with a range of different incredible thought leaders and actors who are advancing this work in their own right. So with that, I am going to introduce our incredible colleague, Karen Marks from IEA, to share a little bit about the partnership. So Karen, I'll hand it to you.
Thank you, Erin, for the introduction. Hi, everybody. I'm Karen Marks, the Director of Strategic Partnerships in the HHS Office of Intergovernmental and External Affairs. As you've heard from Admiral Levine, Erin, and Rachel earlier, the Food as Medicine Initiative is a collaboration within HHS and across all of our sister federal agencies. But it's also a collaboration with our external stakeholders and those focusing on this issue on the ground as well. Earlier this year, in January, HHS launched 3 public-private partnerships at the HHS Food as Medicine Summit. These partnerships are primarily centered around the exchange of information and ideas to promote food as medicine by advancing and leveraging research design and findings, coordinating language to design effective communication, enabling effective implementation strategies, and strengthening the equitable infrastructure around food as medicine. Today, I want to share a few more details about our activities and focus areas with our partners and announce a newly formed partnership. Our first partnership is with Rockefeller Foundation, who is an institutional partner around research and communication. HHS is working closely with Rockefeller to share information and ideas that will support a greater understanding of food as medicine and its return on investment. Instacart, which we all know represents retail and we all use for shopping and aligns with our interests in supporting healthy storefronts and consumer access and understanding of nutrition and health. We're working together with Instacart to identify ways to promote healthier consumer choices. Feeding America and HHS are working closely together to support that integration that's so important between food banks and the food as medicine landscape, really looking at how we can bridge care between healthcare and food access. And today, we are excited to announce that HHS has signed a new MOU with Food and Society at the Aspen Institute. This partnership aims to improve health outcomes and health equity by engaging a broader public audience in understanding nutrition and food as medicine to accelerate that collective understanding of FIM interventions and their impacts, and to explore strategies to scale successful FIM programs to more eligible Americans. And as always, we're always open to additional ideas to advance food as medicine and to bring additional partners to the table. Please feel free to reach out to us at partnerwithus@HHS.gov if you're interested. And Erin, I'll turn it back to you. Thank you.
This is Rachel, and unfortunately my camera does not seem to be working, so apologies for that. But just really want to thank you again for being with us today and just for learning about this. As you could tell from Erin, we are just truly passionate about this work. It has really been a labor of love. We are just so inspired every day by the stories of different organizations that are advancing this work all over the country in many different ways and different sectors. And it's just continues to inspire us every day. So in terms of next steps, we would just absolutely love if you would continue to share this resource with others that would benefit from it. We'd love for you to continue to champion food as medicine in your own systems and communities. And as we continue to grow our efforts at HHS through different learning and collaborative action opportunities, we hope that you will engage with us. And we would love, I know Erin said this a few times during her remarks, if you have thoughts as you're looking through this toolkit, things that resonate, things that you would like to see, how can we continue to support you and the work that you're doing all over the country? This truly is a whole of society effort, and we at the federal government just are truly happy to be supporting and thinking about ways that we can provide clarity in which our resources help to support you. So with that, I will close us out, but just again, thank you all for joining us today, for taking your time, and we look forward to hearing from you. Thanks so much. Take care.